Dear friends, my name is Dr Shahid. I am consultant PHP Internal Medicine, Max Super Specialty Hospital, Saket, New Delhi. Today we are going to talk about diabetes follow-up. As you know that India has become the diabetic capital of the world, with the ever increasing population being diagnosed as diabetes. On one hand, when we have a large number of patients who remain undiagnosed for a pretty long time and come to us only when the end organ damage has already started. While on the other hand, we have patients whom we diagnose and we have put on treatment but we lose on follow-up. The purpose of this video is to emphasize the need of the follow-up of a diabetic patient. The treatment of patients with oral hypoglycemic agents and insulin forms only the 25% of the management of the diabetes. As we all know, that lifestyle modification in the form of weight reduction, low calorie diet, low carbohydrate, high protein diet and weight and exercise management forms the crux and the most important cornerstone of the diabetes. This alone constitutes the 50% of the management of the diabetes. Now coming up to the follow-up of the diabetes, that's the purpose of this video. Dear friends, when we diagnose the patient as diabetes, the follow-up of the patient becomes mandatory in order to know the status of the patient. The needs of the patient who are diagnosed as diabetes is ever changing. They have a dynamic state. The most important aspect of the diabetic patient is the follow-up, which is the area of my concern today. As I already discussed, that end organ damage to the diabetes is the most threatening condition in a diabetic patient. The rate of damage of a diabetic patient is directly proportional to the glycemic control. In short, we can say better the glycemic control, better is the end organ survival of that patient. We have seen that many diabetic patients who are diagnosed and advised lifestyle modification and drugs do not come for a proper follow-up and land up with the complications of the diabetes. I propose the following management pro forma for the follow-up. Number 1, regular blood sugar management and monitoring at home. Number 2, fasting blood sugar 2 hours prandial and HbA1c every 3 monthly. Kidney function test, microalbumin urea and lipid profile every year, and foot care and foot management should be done by an expert podiatrist. Using proper follow-up and following these patients regularly will avoid the long-term complications and end organ damage to the patients of diabetes. And we can assess the patients regularly and address to their dynamic change of their glycemic control. I hope this video will have helped you in emphasizing the need of follow-up of the patient who have already been diagnosed as diabetes. Thank you.